Greetings. My name is Deborah Posey, and I am the Nursing Capstone Coordinator for both preceptorships and clinical and for class, stimulation. Anyway, this is a short video I wanted to include with a preceptor handbook. And first, I want to thank you so very much for being willing to uh, pass on your expertise to the up-and-coming new nurses. These current students, they're going to be graduating in just a few short months and be joining you in the ranks. And so this preceptorship is a big part of their final semester. It used to be 72 hours, and through feedback from not just yourselves, but also from the students as they completed their preceptorships, they got so much out of what all of you have given to them that we voted as faculty to increase the hours to 84 versus 72. And so therefore, that's what we're looking for. And it can be in any combination of hours as long as once they get to that 84 hours. So anyway, with that, again, I want to thank you for passing on your expertise and being willing to be a part of their education as well, because you are a very vital part. We do have our handbook, and it's about 28 pages. I shortened it up a little bit. I would not going to go directly through them. In fact, I would actually like you to be looking through this as I speak with you, because I'm going to refer to some of the pages that are very important. Like our contact information. Now, since I'm the coordinator for it, I will not be making all the visits to the sites, like come to visit you. We have a couple other educators or faculty members that will be doing it as well. It could be Dr. Davis, it could be Professor Ramos or Cote or myself, or Professor Washington, who's our program head. But things may change, but those right now are the individuals that might come, are to come see you, but I'm not sure who will be seeing you specifically. Anyway, I have both our discipline dean, which is Dr. Hartman, and Professor Washington, that I spoke to just about, who's our program head, and my own information. Contact information is in, it's like the third page within the handout. I do encourage you to print it out. I know that to keep it electronically. I send it to you in a Word doc so that you would be able to type in some of the pages that need to be used, and download them as well. But we do have our philosophy of our program, which falls closely in line with TCC's Tidewater Community College's Go Anywhere. Go here from here, you go anywhere. Sorry about that. Not just philosophy, but mission, and as well as vision, and also for us to be the first choice, which is really, I'm glad to be a part of that. Anyway, I do have our outcomes listed on the within the first couple pages, as far as their learning outcomes overall for the program as well as for this course. I also have listed things on the page 7 that the students should not be doing at any point during their preceptorship. They can observe, obviously, definitely, but not to actually be a part of those decisions, such as like when you're seeing legal documents like DNRs, power of attorneys. They can't be putting their signature on it, in other words. Taking phone or verbal orders from physicians, obtaining any kind of consent because they're not licensed yet at that point. If they go into an OB rotation, they're not to be assessing cervical dilation. If they're pediatrics, no starting of IVs on a pediatric patient of any kind unless CHKD has changed their policy. At this current time, that is the way it stands. Even if you're in a adult area, no more than 2 attempts. That's my own personal rule as well. No, after that, you become frustrated, so we don't want that. And they should not be accessing any implanted port, like many ports. I mean, these are kind of common knowledge, but I just want to make sure that you're aware of those so that they, in their exuberance to learn, I might try to talk you into it. I mean, it's the legalities that go behind it, and also the problems that can develop, as you can appreciate, for the patients themselves. Nor IV narcotic meds, IV push, they can draw it up for you, but they cannot give it to you unless they are licensed, okay? Same with conscious sedation, and no administration of blood transfusion. I mean, they can be part of it, but they are not to be the signer of it or the documenter of it. They can assist with it. I hope that makes sense. And any like PICC line that becomes clotted or the patency is like iffy, we don't want them doing the TPA or alteplase unclotting, if you will. Those they can watch, learn the process, but I would rather that they not be actually doing it because of the problems that it could cause, as we're well aware of. I also have several pages in here, actually just a couple of them, that come directly from the Board of Nursing's, State Board of Nursing's regulations that cover, or garner, or, cover us both with, both you, your hospital, the school, the student, as far as preceptorships and what they should, are allowed to do, what we're allowed, our specific things we should be attending to. I also have included in here, since we are ASIN certified, we did get our continuation for another 10 years. We'll be getting our Virginia Board Nursing visit next year, 25. But anyway, that I included the section there that pertains to preceptorships. And one of the reasons why I'm adding a video in. Meeting specifically with each one of you would be very difficult, as you can imagine, because we're at all the facilities and all the shifts, all the areas. I just want to make a blanket one as far as for introduction. And so you could associate a face with the name too, as far as that goes. A specific little message to you as a preceptor, as far as precepting the students, nurse, and evaluation, and your responsibilities, which is, I'll read them, you can read them as well, but the big one is that there, at the beginning, there is an agreement that needs to be signed by you and the preceptee, and then they'll send that to me through Canvas, which is our learning platform. Then I'll sign it and keep a copy of it. It's a legally binding document between yourself, your hospital, us, and the student. Then the orientation, you do need to do an orientation to the unit. If you're in a Centera facility, this is mandatory. I believe I have included, yes, I believe don't quote me on that, if I included that or not. If not, I'm not seeing it in here. Son of a gun. All right, so what I will do is make sure that one is attached with this email. I know I would have been given one by Centera. Now, unless you're not a Centera facility, then I will not, of course. But they still should be oriented. The students still should be oriented to the unit, so they at the beginning, so they'll become a little bit more familiar. And let's see, giving them regular feedback, very important. I know we got a form that you'll fill out on a daily basis for them. They're required to upload that into Canvas. That should be at the end of the day, or the next morning if you're on a night shift type thing. But it's asking for your feedback and how they did, and some written feedback on there for them would be good because they do read them, and we do too. So if there's any issue, we definitely want you to contact us right away. Well, you can contact me and go from there, as well as write it on there, any issues that you may come across. Little information in here is with things, if you're precepting already, you're probably pretty well aware of all the other different things, like the different phases of precepting, the reality shock from novice to expert that they go through. But I just have some guidelines in here. Yeah, also some tips from expert preceptors, and you might even recognize some from your own self for that matters, because I take a lot of these from comments that are made on feedback from y'all, okay? Also have reference to back everything up. And in the back on pages 18, 19, 18 and 19 has the actual skills that they are able to do that they've had on campus here. They've done it in the lab, or they've done it also in clinical with me, and definitely with other instructors as well. They've all had hands-on, or either in lab with all of these at one point or another. As far as something like CPAP, BiPAP, chest tube care, high flow oxygen, outline care, it all depends on where we've been able to get them into for a clinical. So it may be endotracheal suctioning, that kind of stuff. Those things may need to be definitely monitored at first, have them observe, see one, maybe even allow them you have to get your own feel of the student too. Anyway, on page 20 and 21, that is where that form was that I was talking to you about. that needs to be signed. It's the binding document. It's called the Associate Degree Nursing Program Preceptorship Agreement. And it has, I quote in here from the Virginia Board of Nursing, the areas that cover this as well. I'll need your signature and date, and as well as your years of experience, your highest degree obtained. It can be an ADN. It doesn't have to be a BSN. If you have that or your master's, thank you. Thank you very much. I know all the time it takes because I'm looking at my doctorate still, so I get that. And one thing we have added as far as this agreement, and that is, and this is per the board, and that is be a copy of your nursing license. It could be the one you carry with you, or it could be one right out, like if you don't have one handy, let them know. We can get it off of their website, but I prefer to have just a copy of one of yours and attach it to the back. That way we have it from you. On page 22 and 23 actually, is 23 is the actual schedule that the student should fill out. It's even if you're only able to give them a 1 day to begin with, that's great. They need to upload that so that we know that they've been in contact with you and that the process has begun. They also need to include when you see it, your manager or your educator for your department. That contact information should be on there also. So, and we do ask for your email address so that, because I do send out a little thank you at the end, a little certificate of thanks and appreciation that you can add to your resume, actually. On the 24, there's, for the evaluation tool that we use, it's on 25, it gives you some ideas what to be looking for in those certain areas in the criteria, from pharmacology, collaboration, quality improvement, professional behavior, it's a big one, of course, the clinical judgment, really big, safety, I don't even have to say anything about that one, and client-centered care is which is what we really firmly believe in. And so that's what their evaluation that you would be doing on them every day they are, or night that they are with you, every shift they are with you. Be on page 26. We would like to have some feedback on your experience as a preceptor for us, and particularly with that student, and how if things have changed, gotten better, gotten worse. Whatever we can do to make it better for you, we would really like that. We also included a needs survey from you, and I've been gathering the data on that and see what we can adjust. That's how we went up on the hours that I was talking to you about. Both of these forms we brought that to light. So now that's a reality. And the last one, the student does do an evaluation of you. So we have to include that. We want their feedback as well. And I'm hoping that it's a good fit for you. If not, with either one, please get in touch with us. Don't let it go through the whole thing and to the point where the student feels like they can't, interact with you, or you don't feel comfortable interacting with them. Let me know. My phone number isn't there, but I'll tell you it again. My cell phone is 804-854-9364, and it's my cell phone. So you can text me. I may not get back to you in the middle of the night, but sometimes I'm up until 1 or 2 in the morning. But I definitely will get back to you, and I am available regardless. If you can't get a hold of any one of us, whether it be Professor Davis, and I don't have her information there, but I can get that to you if you need it. If you have any questions, please reach out to me. Like I said, my cell phone number, my email is dposey, P-O-S-E-Y, D-P-O-S-E-Y, at tcc.edu. And I do get that on my phone as well, so you can get in touch with me either way, by phone, email, text message. And thank you again for allowing us to come into your world and our student to come into your world, because like I said, you're a big part of their nursing education, one they will not forget. They will take this with them. So again, thank you and have a beautiful day.